Hey YouTube, it's Marita, and it's been a long time, but I'm here to do a video, and this video's topic is, are you making the grade? So, I have been here in my office for the past week advising mainly transfer students. And when I'm advising, what I basically have to do is basically kind of go through their transcripts, see what they need to take, see what they have taken, and basically formulate a plan for them to be successful in preparing to start the nursing program. So with that being said, I've come across a reoccurring theme. The reoccurring theme is simply this. People are not qualified for nursing school due to one of two reasons: low GPA, or their nursing prereq classes, so the classes that are specifically needed to be admitted into nursing school, they're making very low grades in those. So for instance, here at our school and many other competitive programs, you will find that they only will allow, you're only a candidate for the program if you have a C or better in your science classes, like your anatomy, physiology 1 and 2, your microbiology, and here we require pathophysiology. In those classes, we require a C or better on the first time that you take the class. So if you take the class 3 and 4 or 5 times, that's fine. However, they're only going to look at the first time that you took it. So keep that in mind when you are trying to find a nursing program. If you've already taken these classes, you've already taken them, you need to be mindful of that, because you may not be a candidate for certain programs based off of those classes if you've made a D on those classes. If you've made a C or better, you can be a candidate if your GPA is high enough. So be mindful of those things. So if you have not taken the classes already, if you haven't taken them, let this be advice to you that you need to go ahead and be prepared and study for those classes and take them and do the best you can in those classes so that you can be competitive when you go to seek out your spot in a nursing program. Now, with that being said, if you have already taken them, like I just said, you may have to find a program that does not require you to have a first time pass of a C or better in those programs. That's going to be a big deal. Also, one other word of advice is to take your science classes right before you get ready to apply for nursing school. So of course you have to take them. You can't take them all at the same time. I get that. But you want to take them the year before, 2 years before, something like that. The older it is, or the longer it's been since you've taken the classes, the harder it is to retain or recall the information that you learned from those classes. And keep in mind, nursing school builds from A&P, micro, patho. It builds from those classes. So if you just took those classes the year or two prior and you go into nursing school, you have an easier time in terms of understanding the new concepts in nursing school than you would if you took those classes, say, 5 years ago. So I know most programs will accept your science classes up to 5 years, sometimes even more. But just be mindful. If you took a class 6, 7 years ago, do you honestly remember the stuff that you learned in that class? Do you remember the concepts, the content? And when you need that as a foundation for nursing, how do you think you're going to fare? So again, that's just some advice, just to make sure that you learn what you need to learn. You make those good grades. So when I say, are you making the grade? Keep in mind, your overall GPA can be a 3.5. But if your nursing classes or your prerequisite for nursing classes are low, you may not get into the program. So it's not just the overall GPA they look at. The competitive programs are looking at those sciences in particular because they want to know, are you going to be successful in this program? And we all know that science classes are a foundation. The A&P, micro, again, those classes are a foundation for nursing school. So I want you to take heed. If you feel like you've already taken these classes and you feel like, okay, I don't think I remember, well, go on Amazon and purchase you some A&P books, study books, and just kind of review. That will help you tremendously. So again, quick video. I know it's been a long time, but it's been crazy because of work. That's what I'm doing now, working, getting ready for lecture next week. And so anytime I think of something, I want to drop a gem real quick, I will come and do a video, and here we are. So again, if it doesn't apply to you, then let it fly. But thank you for watching this video in its entirety. If you have something you want me to talk about in terms of video, please comment that below. And until the next time, you all have a good day. Bye-bye.